I'm Emily Mashak, and you're listening to Tuned Into NoCo, Town Square Media's show that lets you know what matters in NoCo. I'm talking today with Dr. Andrea Klemes, the Chief Medical Officer with MDVIP, about a new survey that shows how COVID-19 is affecting Americans' brain health. So thank you for joining me today, Doctor.
Thank you for having me.
Now, the survey shows that most Americans don't really know that much about brain health, especially when it comes to things like dementia and Alzheimer's, but it shows that Americans are also really worried about these diseases. Why do you think there is a disconnect between what Americans are aware of and what they're worried about?
The MDVIP survey showed that 2 out of 3 people were concerned about brain health and cognitive decline, yet nearly half failed the brain health IQ quiz. So I think that disconnect is education, which is the point of doing the survey and bringing it out during World Alzheimer's Month, to really increase awareness. Many people think Alzheimer's is just a normal consequence of aging, and it's not. That was one of the questions on the brain health IQ quiz that they got wrong. So you need to understand what your risk factors are. You need to find a physician, like an MDVIP physician, who can partner with you and help you understand your own risk factors and help coach you so you can help support your brain health.
What do you think most Americans really don't know about dementia and Alzheimer's? What are the facts that people are really missing?
You know, I think one of the most surprising ones was that only 1 in 3 people knew that there were diseases that mimic Alzheimer's, but are treatable and curable. So dementia is really a big bucket of cognitive decline issues. Alzheimer's is one piece of that bucket. There's also other things like Alzheimer's, like Lewy body dementia, and the Parkinson's dementia, things that with that cognitive decline, there's not a lot that you can do. But there's other things, other diseases that mimic it, like thyroid disease, depression, bleeding in the brain, dehydration, vitamin deficiencies, all things that a physician can help determine in you, diagnose, and help treat so they can clear up those brain issues.
Now, clearly going to a physician is one of the best ways that people can address concerns about their own brain health. But what signs should they be looking for if they fear that they or a loved one might be facing cognitive decline?
Your red flags for Alzheimer's are things like memory loss that disrupts daily life. A quick example, I had a patient who was in her 80s, diabetic, very sweet lady, and we couldn't get her sugars under control. I started working with her daughter-in-law, who drew up her insulin and put it in boxes in the refrigerator. And when the daughter-in-law went to check on her, found that she'd forgotten to take her insulin. And we had been dealing with this for months, but she was very good at sort of throwing us off the track and not letting us realize that she was having this memory loss that was affecting her daily life. Poor judgment, poor decision-making. Those are more red flags for Alzheimer's. Things that are normal consequence of aging. You go in a room and you forget why you went in there. You remember 20 minutes later, or you can't remember the name of an actress's name from a movie. That's all normal aging and memory loss, or just being, a little bit forgetful.
Now, last time we talked, we learned that the COVID-19 pandemic has had a negative effect on Americans' mental health. How do you think this coincides with what you're seeing now about Americans' relation to their own brain health?
The MDVIP survey showed that 2 out of 3 people had increased feelings of depression, anxiety, but then they also felt 1 in 2 felt they had mood changes, personality changes, even brain fog, fuzzy, you can't remember the words. You just don't have the motivation or with it. So it has remarkably affected most Americans. And then those already who've had cognitive decline, 60% were more depressed, more anxious, and had a worsening of the cognitive decline. So the pandemic, on top of everything else, has really thrown some people for a loop.
What would your advice be for people who are feeling increasingly depressed during this time?
We saw in the survey 70% of people had confidence in their doctor, yet only 8% had asked for help. You need to find a physician, like an MDVIP physician, who has that time to sit and talk with you. I talked to one of my docs this week, and he said he spent 20 minutes with a patient who said, I'm having issues. I really think the best thing for me would be to see my family. Can I safely see my grandkids. And they literally went through each grandkid. One went to college. He said, you can't see that one. But, the 5-year-old who lives with the parents who are all working from home and the kids doing school virtually, said, you can see them. So you need to partner with somebody who knows you and your risk factors, but can also help support you. And if you need even further treatment, whether it's referring you to somebody or some medication, but I think most of the time it's just that support, bringing positive people into your life, and making sure you're connecting with family members and friends.
Hmm. That is great advice, especially for taking care of your mental health. And now, kind of expanding on that, what could we do to reduce our risk of cognitive decline in the future, say to prevent Alzheimer's and dementia as we do get older?
Well, one of the things you hear from every doctor is what? Eat right and exercise. So I'm going to say the same thing. It prevents heart disease. It helps with your brain health. Also, getting enough sleep. Making sure you are screened for depression and hearing loss, all things that affect your brain health. Keeping your brain active. The pandemic has made it very hard to do that because some people have sort of gotten in a rut and are watching TV or just watching videos. But, try and read or play some brain games or, do something that helps keep your brain active and make sure that you don't socially isolate. And I guess on top of it all, prioritize some time for yourself. If you are the type who's taking care of parents and kids and spouses and everyone else, make sure there's some time for you.
What else do you think the survey revealed about the American population and their relation to mental and brain health?
Interestingly, 80% of people were motivated, silver lining, motivated to do something about their brain health, but only 1 in 4 knew what diseases put them at risk or what other risk factors there could be. So diseases that put you at risk are things like diabetes, other things you need to worry about, gum disease, you need to go to the dentist, periodontal disease, not only increases your risk for heart attack, but increases your risk for cognitive decline. So they need to learn what the risk factors are, what diseases can put them more at risk, and then how they can control those risks.
Hmm. What else do you think listeners need to know about this survey or about brain health in general?
I think getting education, making sure people know that Alzheimer's is fatal. That was one of the questions they got wrong. Alzheimer's is not a normal consequence of aging. And when you look at that broader bucket of cognitive decline, there are many things in that bucket. It's not just Alzheimer's. Alzheimer's can only really be diagnosed accurately by an autopsy. So that it's almost a diagnosis of exclusion once you've made sure that you don't have other things that you can treat. And so you need to make sure that you're looking for those other things and working with a doctor who can help you.
Definitely. Well, thank you so much, Dr. Klemes, for taking the time to talk to me today. This was a really interesting survey, and I'm glad you could share it with us.
Thank you. And if you want to take the survey, you can go to mdvip.com/brain health, see how you do, learn a little bit more about brain health. And if I may, please wear a mask and get your flu shot.
Again, that was Dr. Andrea Klemes, the Chief Medical Officer with MDVIP. Learn more about brain health and their survey at mdvip.com.